It's been 285 days since Russia invaded Ukraine, and the country is still enduring waves of missile attacks. The U.S. is prepared to assist Ukrainians as they get ready for a brutal winter, and many nonprofits are gathering resources. LA-based International Medical Corps is one of them. Ariel Wessler has more.
This was a state-of-the-art hospital.
From his global headquarters in Los Angeles, Todd Bernhardt with International Medical Corps looks at pictures of devastation from his last trip to Ukraine.
We have gone in and rebuilt healthcare facilities that were destroyed. We are making sure in areas that are still under attack that they have the medical supplies that they need.
International Medical Corps is a global first responder that assists with conflicts, diseases, and disasters around the world. The nonprofit has a team of 300 people on the ground right now in Ukraine, 10 times more than the 30 they had when the invasion began. And as waves of rockets rain down, Bernhardt says they have to get creative to keep the Ukrainian people safe.
In Odessa, we work with a maternity hospital and have created a fully functional neonatal intensive care unit in their basement, so that these very vulnerable human beings in the first hours and days of their lives are not under threat from potential attack.
We are here. We are at the front line.
Dr. John Roberts, who goes by JR, was brought on to help IMC design its emergency medical team, a mobile field hospital that can be deployed anywhere in the world within 72 hours. He says the vast majority of patients they are treating do not have gunshot wounds or injuries related to missile attacks.
Just because there's a war going on doesn't mean that people stop having babies. It doesn't mean that people stop having high blood pressure or diabetes or HIV or, COVID even.
They also focus on mental health services and access to clean water, a necessity for treating disease.
Hospitals are getting destroyed, daycare centers are getting destroyed, sewage plants are getting destroyed. So all of a sudden, if you can't separate clean from dirty water, then you're dealing with a whole nother host of issues.
Still, IMC says its mission isn't to just create temporary fixes, but rather provide actual medical training to Ukrainian doctors, nurses, and hospital staff, all through a partnership with Harvard Humanitarian Initiative.
So that, a family medicine doctor could treat a gunshot wound, or a trauma nurse knew how to handle 100 new casualties all at once. Ukraine has a lot of really talented doctors and nurses and paramedics, but they didn't know how to do trauma, and they didn't know much about chemical weapons or mass casualty.
So far, the program has trained more than 2,500 people. And with winter fast approaching, Bernhardt and Roberts say they are committed to the Ukrainian people, knowing the need for vital resources and medical care remains as important as ever.
And Ariel Wessler joins us now. Ariel, how did International Medical Corps get its start?
So the organization started in 1984. It was started by a man named Dr. Bob Simon, who traveled to Afghanistan to help the people there, interestingly affected by the Soviet invasion. And now 38 years later, we've got a Russia invasion of Ukraine, and that same organization responding. And I want to show you a picture from 1984 of Dr. Bob Simon. Here he is doing surgery by candlelight in a cave in Afghanistan and training some of the medical staff there. This is in the 80s, really creating this mission for the group to provide training. So, the saying, give a man a fish, he eats for a day, teach a man to fish. And that's really the whole concept here, is go in there and work within their medical system to try to train folks wherever they are to be able to do some of this work themselves.
And what do they tell you about how working in a place like Ukraine compares with other places that they've worked, like Haiti?
Yeah, so it's interesting. So JR, the doctor who you heard from in that piece, told me a place like Haiti has so many needs all the time that when you have a disaster like an earthquake, that just exacerbates the problem. But even without that earthquake, there are so many needs. Ukraine, a middle-income country doing fairly well on its own and had an established healthcare system. So he says you would think that would be easier. Not so much. He says you can't just drop a bunch of stuff somewhere and assume that it's going to get where it needs to go and that it's going to work. He goes, you have to kind of fix their systems and learn to reestablish them, work within that system instead of just kind of suddenly setting stuff up and doing it your own way. So something that might work in Haiti isn't necessarily going to work in Ukraine, and that takes a process to adjust.
Yeah, and I'm curious, what made Dr. Roberts get into mobile medicine in the first place?
Yeah, I asked him. He's from Mississippi, and he saw the devastation when he was in college from Hurricane Katrina, and at one point, he passed a field hospital, and he goes, yes, this is what I want to do. He saw the work going on there. He was amazed. And from then on, went to medical school, actually trained at LA County USC, which I don't know if you've seen the documentary Code Black. But
yes, done by Ryan McGarry, frequent guest on this program. I love that.
Yeah, and so he worked in that emergency department, and it really tests the doctors. And then he says, you know, ER doctors that go to places like Ukraine, they're tested again because a lot of doctors think that this is about them. And he goes, when you go to a place like Ukraine, the ER doctors that are the best are not the ones that necessarily have the best trauma skills, but get to know the people and get to know the system and are really able to do their work by getting to know their patients. I asked him if he's ever scared. He goes, you know, he says you train yourself to be constantly on guard. He says he is apprehensive. But he's really happy to be over there.
That just gave me chills. Ariel Wessler, thank you so much for your fine reporting on this. Appreciate it.
Thanks, Alex.